To be back in Southwest Florida. I'm proud to be joined here by the Florida Surgeon General, Dr. Joe Ladapo. We also have some folks from Southwest Florida who are going to talk about some of the treatments that they were able to receive through our monoclonal antibody program that we launched in August. And if you remember at that time, we were seeing a wave. There were a lot of people being admitted into hospitals in very high numbers. It was clear that virtually none of them had even known, much less received, any type of early treatment prior to being hospitalized. And so we felt that that was a big shortcoming. We needed to figure out how could we address it. And the main thing was getting people to know that this was something that was out there, because though there were some hospitals and some physicians that had embraced it, there were a lot that didn't even know about the monoclonal antibodies that were available. So we went around, made sure we raised the recognition, but also wanted to increase access. So we ended up setting up 25 different sites throughout the state of Florida. We've now done, I think, over 135,000 treatments of individuals throughout the state since the middle of August. And this is something that filled a huge need. And really the results speak for themselves. Since we established our monoclonal antibody program in middle of August, the 7-day average of hospital admissions has fallen over 50 consecutive days. It's now fallen over 80%, and these are the daily people that are going in. Clearly, the whole purpose of these monoclonals is keep people out of the hospital, let them recover. We've also seen 51 consecutive days of the hospital census statewide for COVID decline. We're now looking at, I think we're one of only 3 or 4 states in the whole country right now that has daily admissions that are pre-Delta levels. And we're also one of the 5 lowest states for infections generally in terms of the daily infections, and in the bottom 5 for cases, and maybe even one or two least for infections, which are more estimated, not necessarily just the cases. But either way, we see that that's something that's had very, very positive. So the result is we've had 130,000+ treatments. Maybe not everyone, of course, would have been admitted to the hospital, but many of those people would have had they not gotten early treatments. And so we've saved thousands upon thousands upon thousands of people from having to be admitted into the hospital, and there's no question that we've saved many lives as a result of making these treatments accessible to people. Now, recently, as we got into the middle of September, the Biden administration decided to cut severely the amount of Regeneron monoclonal antibodies that was being sent to the state of Florida, as well as Texas and some other disfavored states. That was something that we were very concerned about, because we knew that there was a demand for it and wanted to make sure that if folks needed the treatment, that they were able to get the treatment. And so I looked to see what are our options, and it turned out there was another very effective monoclonal antibody treatment called sotrovimab that was made by GlaxoSmithKline that had recently received emergency use authorization. We went directly, got sotrovimab to the state of Florida, deployed it, and really that helped serve as a bridge to be able to go through and get over the reductions that we've seen. Now, fortunately now, our infections are so low and the demand is so low for early treatment that even reduced amounts will get us to where we are now. That wasn't necessarily the case a month and a half ago. So that sotrovimab really helped us make sure that everyone was able to have access to this. Going forward, of course, we're doing now where we were doing 4,500 to 5,000 treatments a day through our state sites. Now we're typically looking at 700 or 800 a day, again, because we have one of the 5 lowest infection rates in the country right now. Nevertheless, we know these things ebb and flow. You'll have waves, they go down, and sometimes they'll come back up. So we're looking at that. We'll obviously monitor that as we get into the winter and see what differences may happen. But we want to make sure that people understand this is something that we're going to work very hard to make sure people have access to now and in the future. And I think how we did it with sotrovimab really required us to think very quickly, to do whatever we could, and we were able to meet the demand. And then now, of course, well, fortunately, we have much, much lower demand, which is a really, really good thing. Now, I want to bring up some folks to be able to talk about this, and then we'll hear from the Surgeon General. So I have Michelle Albergo here. Now, she's an ultrasound technician in Southwest Florida. She got monoclonal antibodies on a prophylactic basis because she had an exposure to someone who was COVID positive, and she did the Regeneron. But more recently, her mother-in-law and father-in-law, Geraldine and Joe, they received the sotrovimab at our Bonita Springs state location. So she's going to talk about her experience and about their experience.